Welcome back to the channel, goat lovers. Today, we're facing one of the most intense moments any goat owner can experience. Prim, our gentle doe, has gone overdue. Her due date passed several days ago, and now she's clearly in pain. Her breathing is heavy, she's restless, and the worry is real. Will the kids come safely? Will Prim make it through this difficult labor? This is a real-life kidding story full of tension, lessons, and hope. And we're going to walk through every detail so you can be better prepared if this ever happens to your herd. If you're new here, hit subscribe and turn on notifications. These raw birth updates and goat care tips could make a huge difference for your animals one day. First, let's understand why overdue kidding is so stressful. The average gestation for goats is around 150 days, but every breed is a little different. Some does deliver a week early, others go a week or even 2 weeks late. Prim crossed the 155-day mark, which puts her firmly in overdue territory. When a doe lingers past her expected date, several risks increase quickly. The biggest concern is pregnancy toxemia, also called ketosis, where the doe's body starts breaking down her own fat for energy because the kids are demanding so much. She could become weak, stop eating, look depressed, and in severe cases, it becomes life-threatening for both her and the babies. Another danger with overdue births is that the kids can grow larger than normal, making delivery more difficult, what we call dystocia. There's also a higher chance of stillbirths, or very weak newborns who struggle to breathe or nurse. But even with all these risks, many does still deliver perfectly healthy kids even when late. The secret is close monitoring, quick recognition of warning signs, and being fully prepared to step in if needed. Prim started showing clear labor signals a couple of days ago. Her udder filled up dramatically overnight. It became tight, shiny, and the teats stood out like they were ready to burst. Her vulva swelled and then relaxed, which is a classic progression. The ligaments on either side of her tailhead, right where the spine slopes down, went from feeling hard and pencil-thick to completely soft. When those ligaments disappear, and you can almost wrap your fingers all the way around the base of the tail, kidding is usually only hours away. She also began nesting behavior, pawing at the straw, walking in circles, lying down and then standing up again as if she couldn't get comfortable. Her tail arched up and pointed downward, and we noticed a clear to milky discharge from her vulva. All these signs told us active labor was starting soon. We immediately moved her to a clean, quiet kidding stall lined with fresh pine shavings. The area was warm, dry, and isolated from the rest of the herd, so nothing could interfere. We had our full kidding kit ready: clean rags, paper towels, several thick towels, a flashlight for night checks, scissors to open the amniotic sac if needed, a baby bulb syringe to clear airways, betadine scrub, soap, personal lubricant, dental floss for tying the cord, and a small container of iodine for dipping the umbilical stump. Does in labor often want privacy, and Prim was no exception. She preferred to stand for a while, then lie down, then stand again. We stayed close but gave her space, only stepping in to make sure she wasn't positioning herself in a dangerous spot or blocking access if help was needed. Labor can be unpredictable. For a first-time doe, it might last 12 hours or longer, and even experienced does can take several hours. We knew that if she was carrying multiples, which is very common, we might need extra hands to handle cleaning and drying each kid quickly while another was still coming. When active pushing began, we saw the first water bag appear, a thick, clear amniotic bubble. Contractions grew stronger and more regular. After about 45 minutes of hard pushing, the first kid's front feet emerged, followed quickly by the head in the perfect diving position. 2 feet forward, head tucked between them. Prim gave one final big push, and the first kid slid out. We gently broke the membrane, cleared the nostrils and mouth with a bulb syringe, and the little doeling took her first breath and cried. She was alive and strong. Almost immediately, the next contraction started. The second kid came breech, back feet first. That's a riskier presentation because the kid can start breathing while still partly inside and inhale fluid. We stayed calm, gently assisted during the next contraction, and pulled downward to guide the kid out safely. The third kid followed in normal position, front feet and head, and all 3 were delivered within about an hour and a half. Right after each birth, we cut the umbilical cord to about 3 to 4 inches long and dipped the stump in 7% iodine to prevent infection. If there had been bleeding, we would have tied it off with dental floss. But in this case, it stopped naturally. Prim instinctively began licking and cleaning her babies, which helped stimulate breathing and bonding. We guided the weaker ones to the teats so they could get that vital first colostrum, the thick, antibody-rich milk that comes before regular milk. Colostrum in the first 2 to 4 hours is absolutely critical for building their immune system and protecting them from infections in the early days. If a kid is too weak to nurse, we bottle feed colostrum from the dough or use a stored colostrum supplement as backup. We kept a very close eye on all 3 kids for the first few days, making sure they were nursing well, staying warm, and not being pushed around by the rest of the herd. For now, Prim and the triplets are separated in a safe pen so the newborns can gain strength without risk. This overdue kidding was intense, emotional, and full of lessons. Track breeding dates carefully so you know the due window. Prepare the kidding stall and kit well in advance. Learn to check those tail ligaments. It's one of the most reliable signs. Have your vet's number ready and put them on notice when kidding is near. Be patient. Labor can take time. But act quickly if something looks wrong, like wrong presentation or no progress after an hour of pushing. Most does deliver on their own without major issues, but when problems arise, confidence and preparation make all the difference. Prim made it through, and her 3 beautiful kids are thriving. What an incredible relief. If you've ever had an overdue or difficult birth, drop a comment below and share your story. It helps everyone learn. If this video gave you useful tips or eased your mind for your own kidding season, please give it a like. Subscribe and hit the bell for more real goat birth stories, care guides, and farming updates in 2026. Thanks so much for watching. Stay safe with your herd, and we'll see you in the next one.